I now recognize the honorable member from the Ministry of Health and Wellness.
Thank you, Mr. Speaker. Mr. Speaker, I wish to graciously thank Jehovah Jireh, provider, my Lord and Savior Jesus Christ, and the Holy Spirit, who is indeed the head of my life. Mr. Speaker, I also wish to extend greetings to the host of angels that work throughout the Commonwealth of the Bahamas, dispatched across our archipelago, from Inagua in the south to Abaco in the north. These are the fine employees of the Ministry of Health and Wellness that I call angels, Mr. Speaker. I wish to also extend a heartfelt condolences to the resilient and serene and tranquil community of Machu Tango, Inagua, and the Harvey family on the passing of Mr. Wade Harvey, and other outstanding great members of our community on whom shoulders I stand on, like my grandparents, Mr. and Drusilla Higgs, my mother, Marion Higgs, and too many others to mention. But last or not least, Mr. Speaker, I beg permission from you to acknowledge my Queen, Her Majesty, Richinda Miller, a stellar public servant, sir, of some 20+ years, sir. I wish to also extend a heartfelt thank you to our 4 kids and say a special thank you to friends and family that are tuned in from around the world as far as Ireland right now, Mr. Speaker. Now to the matter of hand, Mr. Speaker. This public service we seek to reform, Mr. Speaker. I joined this public service in 2019 and very quickly became aware of the various challenges faced by public servants, some that my colleagues have spoken of today. For example, Mr. Speaker, it took me 3 months to get paid. Wow. And I heard that was short, Mr. Speaker, in comparison to others. But, Mr. Speaker, you know what the problem is? You know what the problem seems to be in the public service, Mr. Speaker?
Order, honorable members.
And I've heard many of my colleagues allude to it, and I think I was in the spirit, like we say in the Bahamas, when I decided to bring this today. This ACR, Mr. Speaker, this sacred document that seems to be the threatening bow of all public servants, Mr. Speaker. This seems to be the problem that does not reflect, Mr. Speaker, the enduring circumstances that we as public servants endure on a daily basis to deliver service to a demanding Bahamian public, Mr. Speaker. Mr. Speaker, in March of 2020, the public service faced its greatest challenge thus far. We public servants were tasked with delivering services to one of the most precious populations of people on the planet, Bahamians, and we all know what it to be precious. While doing this, Mr. Speaker, public servants also had to navigate our country through a Category 5 historical hurricane, and then shortly thereafter, a global pandemic, Mr. Speaker. Mr. Speaker, I thank God for the angels of the Ministry of Health and Wellness, Mr. Speaker. We rolled up our sleeves, Mr. Speaker. Mr. Speaker, we rolled up our sleeves and we put on our masks and we did our very best to serve this Bahamian public across this Commonwealth, Mr. Speaker. While employed in the Policy and Research Unit as an administrative assistant to Dr. Kelly Philippe, a senior medical officer in the Ministry of Health, I call this pandemic, Mr. Speaker, a miracle moment. I wonder why. I call it that because this was the opportunity for us, Mr. Speaker, to truly once and for all fix, if not reset, the systems that were seemingly failing us as a country, Mr. Speaker, or if only outdated. In particular, our healthcare systems, Mr. Speaker. Again, I call it a miracle moment, Mr. Speaker, because more than ever, this time, I saw Bahamians working together, not seeming to even care whether they got sick, all in an effort, again, to serve a demanding public, Mr. Speaker. I literally saw miracles on a daily basis in the workplace, Mr. Speaker. Miracles being done by Bahamians, ensuring that the many needs of us were being met. It was at this time, Mr. Speaker, that the World Health Organization released national toolkits to aid in the fight of the global pandemic and help governments respond as a result of this pandemic. It was recommended governments should do everything in their power to bolster and support its public servants with routine well-being checks and evaluations to avoid them being burnt out and overexposed to trauma and high levels of stress. This is what we watched on our streets, Mr. Speaker. In December of 2021, Mr. Speaker, I was asked by Dr. Novia Carter, Deputy Permanent Secretary in the Ministry of Health and Wellness and Director of the Bahamas National Drug Council, to join her team. They're seated right here in the gallery today, Mr. Speaker, to join those people in assisting in the work of healing our communities, Mr. Speaker. Mr. Speaker, immediately upon accepting such a challenge, understanding that this was my passion, seeing the transformation that God had done in my life happen on a national level, Mr. Speaker, immediately the Bahamas National Drug Council set out to implement recommendations offered by the World Health Organization to bolster public servants whose shoulders and lives we had depended on for our very security and caregiving. We immediately worked with essential workers like armed force officers on the front lines, informing them of healthy coping mechanisms instead of substance use or overlooked lack of professional processing of the trauma they experience on a day-to-day basis, Mr. Speaker. Mr. Speaker, this helped. Officers today are still asking, is the Bahamas National Drug Council and the Ministry of Health and Wellness going to put on another one of these conferences? Mr. Speaker, as a matter of fact, just in last night, in preparation for this contribution, I quote an armed force officer as I screenshotted his message from a local social media platform. It said, trying to survive this trauma. I ain't come to work for this, end quote. That's the trauma that our public servants, our armed force officers, families to go home to, Mr. Speaker, are under every day. But you know what, Mr. Speaker? Throughout items 1 through 18, as I look through this employee ACR, I don't see much areas, Mr. Speaker, where it seems like we truly care about the well-being of the public servants that we use this ACR to demand optimal performance from, Mr. Speaker. Mr. Speaker, in the 2021-2022 budget cycle, the Ministry of Health and Wellness conducted a rapid assessment of the public agencies in 5 northern and central islands within our Commonwealth. Mr. Speaker, Mr. Speaker, I was never so lost for words. I was perplexed, bewildered, overwhelmed with compassion, Mr. Speaker, as I listened to senior island administrators, high-ranking public servants, along with their line staffs, complaining about the effects of 2, not 1, but 2 natural disasters had on them in the workplace, Mr. Speaker. Mr. Speaker, this ought to have been treated as a human resource crisis in the public servants. But then again, Mr. Speaker, that's ACR to the rescue. Mr. Speaker, these ACRs does not reflect the toll that these catastrophic events have taken on public servants. It does not, Mr. Speaker. Let me explain to you. Mr. Speaker, I remember encountering a public servant with a passion for education, sir. Left passion, that area of work, that area of passion, because he was overwhelmed with stress, Mr. Speaker. Started drinking on the job and decided that, you know what, I just got to go because I can't take this no more. Wow. This is what's happening today in the public service, Mr. Speaker. This isn't foreign to us. Therefore, Mr. Speaker, I hold agency stakeholders very near and dear to my heart, Mr. Speaker, very near and dear to my heart. You may wonder what I'm meaning by that, Mr. Speaker. What I mean is by principals, teachers, nurses, BDF officers, policemen, Mr. Speaker, even the custodian, Mr. Speaker, even the space cleaner, Mr. Speaker. I cannot help but put some respect on their name, Mr. Speaker. Mr. Speaker, I cannot help but highlight people like Mrs. Armley, the principal of Uriah McPhee, who, whenever she calls, Mr. Speaker, whether I'm on Paradise Island at Atlantis at a nice plush Ministry of Health conference where lunch is well prepared, I leave the comforts of Paradise Island, Mr. Speaker, and make my way to Uriah McPhee to serve public servants, Mr. Speaker. Or whether it's Williams, Mr. Speaker, the chief custodian in the Ministry of Health and Wellness, with whom, without her dedicated team of angels, Mr. Speaker, all us you see sitting here in the Ministry of Health and Wellness would be sick as under, Mr. Speaker, without angels like Miss Williams cleaning the Ministry of Health. The custodians, Mr. Speaker, chief among them, just as important as the permanent secretary in the ministry in a pandemic. Or whether it's Nurse Judy Johnson of the Children's Ward, Mr. Speaker, just a good conversation from someone to offload the duties of her day, someone to explain who she helped and who she couldn't help and how she tried to help and what all she could do and what's not. Some of these people just need someone or somewhere to turn, Mr. Speaker. And I'm not talking about the ACR that's once a year. I mean once a year, Mr. Speaker, that's all. Mr. Speaker, as an outreach officer of the Bahamas National Drug Council, that is a calling I take very seriously. Mr. Speaker, allow me to go back again to this ACR document. This document does not adequately address the needs of public servants. Nowhere in this document that show enough care for the well-being of employees versus the optimal performance that the employer requires of us. And mostly, Mr. Speaker, I realize this document is made for compensation purposes. This the document that is used to determine how much they can pay us, Mr. Speaker. This how well we doing. This ain't got nothing to do with the teachers who go to work every day in abusive circumstances where their job is their sanctuary. This document does not know that, Mr. Speaker. Mr. Speaker, my grandmother taught me something. She was the school vendor in Machutown in Nago. She said, what you put in is what you can get out. I firmly believe that, Mr. Speaker. What are we putting into the mental health and overall well-being of public servants, whereas where are the measuring tools similar to this ACR that reflect our well-being? Where are they, Mr. Speaker? Mr. Speaker, again, these ACRs do not speak to the well-being of public servants on a daily basis. This is a once-in-a-year document. Mr. Speaker, part of the problem seems to be leaders are afraid to effectively address this vexing problem of mental health in the workplace, afraid to break down the stigmas that exist, the stigmas that are associated with the acknowledgement for the need of effective mental health treatment strategies and tools. Come on, man. Mr. Speaker, if we're going to be serious about reforming the public service, we got to be serious about breaking down the stigmas related to mental health. Everybody little cuckoo for Cocoa Puffs if you push the wrong button, Mr. Speaker. It just is what it is. I'll never forget a member in this House talked about the effective need for us to evaluate not just members, but all public servants. Where are we on that, Mr. Speaker? Meanwhile, public servants are silently dying from the stress and other ailments without proper mechanisms in place to efficiently and effectively respond to their needs. Mr. Speaker, I will never forget, and I think there are some people in here from the public service who may remember this. An employee died while sitting there assessed, Mr. Speaker. Shortly thereafter, a brief moment of mourning. As I turned the page, the business of the public service moved on as usual. That could be any one of us, Mr. Speaker. This is what's happening in the public service. Therefore, I make it a habit, Mr. Speaker, to buy annually or quarterly to go and pay my mental health physician, Dr. Kavita, regular visits. Ain't no shame in my game. People just tell me the blessings of the Lord look there. record on me, Mr. Speaker. Ain't no shame in my game. That's the way I maintain my winning mindset and my victorious attitude about life, Mr. Speaker. Yes, I was at first, but the benefits far outweighed the fear, Mr. Speaker. And ever since my first visit to the crisis center, as a man who's been to the crisis center, it ain't only for women. Maybe some of us wouldn't abuse some of our wives if we would go and get professional mental help. As a male overwhelmed with stress and stigma associated with mental health, Mr. Speaker, it was only after facing my fears that I had learned that seeking the help of a professional mental health physician was one of the best decisions I had made to safeguard the rest of my life, Mr. Speaker. I walked in with wings broken and left soaring like an eagle, said my physician, Mr. Speaker. Listen to me. I walked in with wings broken and left soaring like an eagle, said my physician, Mr. Speaker. Keeping in touch with my physician and taking personal responsibility, I ain't gonna wait on my government. I can encourage public servants today. Let's start to take personal responsibility for our mental health. And maybe then they will understand the value that is us beyond just these ACRs. Mr. Speaker, as I take personal responsibility for my mental health, this is how I maintain my fight and fight about life. This is how I get from glory to glory, and this is how I keep winning victory after victory, Mr. Speaker. Mr. Speaker, the United States of America, whom we love to emulate so much. When it comes to shopping, we love to emulate America. But why we can't shop at some things that are beneficial to our public servants, Mr. Speaker? Like this, Mr. Speaker, the Mental Health Day for public servants. There's an entire policy of such service in America for the federal government, Mr. Speaker. It is a regular part of the employee appraisal process. It ain't in here, though. It ain't in this one. No. It ain't in this one. Mr. Speaker, I'd like to read into the record a quote. Mental health is an important issue in the workplace. It is a state of well-being in which an individual achieves his or her potential. That's what they tell us they want. Helps you cope effectively with normal challenges of life. Again, the ACR don't show that, Mr. Speaker. It only asks us something once a year. And can work and help us to work more efficiently and productively. To support these efforts, the federal government of the United States of America, through its Office of Personnel Management and Human and Health Services, has released a memorandum to the heads of executive departments and agencies, highlighting the importance of ensuring that the workforce has access to adequate resources for mental health services. The memorandum, Mr. Speaker, highlights key resources for increased awareness and access to services when needed. Quoted from the Office of Personnel Management on the U.S. government website. Mr. Speaker, this is what's missing here in the Bahamas. This is what's missing in our Commonwealth. A comprehensive employee well-being program, Mr. Speaker, that shows the daily trauma that we go through as public servants, Mr. Speaker. Mr. Speaker, this is my last tease, and I hope that not just this House, but public servants around the Commonwealth of the Bahamas would erupt from this one. Days off for mental health with pay, Mr. Speaker, ought to be an order today. Mr. Speaker, days of mental health needs usually are included under government employers' paid time off policies and leave of laws for workers who have covered. Mr. Speaker, I barely could get any of the insurance coverage to cover me for mental health services, sir. As the government consider implementing national health insurance, I think the mental health aspect of our well-being as public servants and behemoths ought to be considered, Mr. Speaker. A point recently reinforced by the U.S. Labor Department laws, Mr. Speaker, end quote. As stated according to the Bloomberg News in an article entitled Paid Leave Covers Mental Health Days, but the stigma still clouds of those resources. Yeah. Meaning that there are resources in the U.S. government, Mr. Speaker, to assist its employees with mental health issues, whether that be the husband just ain't talk to you right this morning, or your wife didn't cook the grits soft enough, Mr. Speaker. there are resources there, but based on the stigmas, this ain't just new to us, Mr. Speaker. The same America we like to go to, they're ailing from some of the same issues. They say when they blow their nose, when they catch the cold, we got to blow our nose. That's how closely related we are. But Mr. Speaker, as I prepare to close, I wish to leave the public servants with a few inspiring and hopefully motivating quotes that will recharge their passions for service. The best way to find yourself is to lose yourself in service to others. Mahatma Gandhi. Only a life lived in service to others is worth living. Albert Einstein. Rejoice in your work. Never lose sight of the angel you are now. This one especially for those Ministry of Health workers, Mr. Speaker. But strive to excel in service, love, and unity. Author unknown, Mr. Speaker, but I can try to keep that one. Finally, Mr. Speaker, as healthcare workers / angels in the Ministry of Health and Wellness, we have the opportunity to heal the heart, the mind, the body, and the soul of our patients, our citizens, their families, our families, and even ourselves, Mr. Speaker. That's the gift that God gave us as healthcare workers, Mr. Speaker. Our names may be forgotten as healthcare workers. But let me tell you all something. People will never forget the way we've made them feel, says Maya Angelou. As I take my seat, Mr. Speaker, as the representative for the Ministry of Health and Wellness and the outreach officer at the Bahamas National Drug Council, I unequivocally support the reform for the public service with a priority being placed on the inclusion of a new employee wellness program, one that's effective, Mr. Speaker. And I ain't talking about one where we talking people business out there, Mr. Speaker, for God's sake. I hear that's what happened to the last something we tried to do, Mr. Speaker. Today, Mr. Speaker, as I take my seat, the Ministry of Health and Wellness has just released our employee wellness survey, Mr. Mr. Speaker, as I spoke to our minister just last week in preparation for this, he said to me, Mandel, as you give your contribution, just the day before, we will be releasing a survey to do exactly what you're advocating in the Ministry of Health and Wellness. And so today, Mr. Speaker, healthcare workers, the angels that I speak of, Mr. Speaker, all across this Commonwealth can go visit our social media pages, Mr. Speaker, and take this invaluable survey. Through this information, Mr. Speaker, we're going to be able to help fix some of the wings of our angels, restore some of their miracle working powers, Mr. Speaker. It's this kind of healthcare survey, Mr. Speaker, that will help us to make better informed decisions in the Ministry of Health and Wellness, Mr. Speaker. Mr. Speaker, and the honorable members of this chamber, I thank you for my time, my opportunity to give a valuable contribution. I yield, Mr. Speaker.
Thank you, Honorable Member, for your contribution from the Ministry of Health and Wellness.